Hi, my name is Lindsay Keel. I'm a student nurse at Troy. I'm going to be doing a head-to-toe assessment on our patient, Mr. Blake Babin, today. So here we go. Alrighty. I'm going to start off by washing my hands and providing privacy, closing all curtains. So our conversation today is just going to be between you and I. Can I have you start off by telling me your name and date of birth, please?
Blake Babin, 8/9/1988.
Alrighty, so that makes you how old?
27.
Okay, wonderful. He looks his age. He is dressed appropriately for today's weather. His posture and his gait when he walked in were appropriate. His mood and affect match the situation. He is answering me appropriately, so he has appropriate hearing, and it looks like he is attending to his hygiene. Can then you tell me if you're in any pain today?
No, ma'am.
Do you have any allergies?
No, ma'am.
Do you take any medications?
No.
Okay, no over-the-counter, no prescriptions, no supplements?
No.
Okay, wonderful. Can you tell me your race that you identify yourself as?
Caucasian?
Okay, so your skin tone matches your race. You don't appear to have any type of lesions or deformities, and you appear pretty comfortable. Okay, so I'm going to use my ophthalmoscope to check out your eyes. Are you wearing any corrective lenses today?
No.
No, okay. If we had a Snellen eye chart, then we would be using it about 4 meters away and checking your eyesight in both eyes, but we don't have that for the purposes of this video. We're just going to skip over that. But if we did have it, then I'd have you start at the top and read each line going down, telling me the characters until you made a mistake in either eye. And then I could calculate your vision. However, we don't have that, so I'm going to have you take a look at me. Alrighty, can you follow my finger?
Mm-hmm.
Okay. Alright. Just look at me, please. Okay. Alrighty, I'm going to use my ophthalmoscope that I have here. If you could look at a spot on the wall and stay there. Okay. Look it in. I'm checking his conjunctiva now. They're both pink, not pale. They're not dry. His sclera is white. His pupils are equal, round, reactive, accommodating. His muscles and landmarks are all in place. Can I have you raise and lower your eyebrows for cranial nerve 3? Thank you very much. Wonderful. Alrighty. So I'm going to check your ears now. The auricles look to be symmetric. Don't have any type of deformities. They appear to be clean from the outside. I'm going to take a look in with my tool that I don't have for the purposes of this video, but we'll take a look in using the otoscope. And I see the tympanic membrane. It is a shiny gray in both ears. Do you have any trouble hearing?
No.
No? Okay, we're going to do a quick hearing test. If you'll repeat after me. A. 12.
12.
C.
C.
Wonderful. B. 9.
9.
X.
X.
Okay, great. I don't have a tuning fork, but if we had one, then we could do the Rhine-Weber test. Weber being starting it off in your head and then making sure that you hear equally in each ear. And then the Rhine test being put on the mandibular process, making sure you could hear it loudly after you stopped hearing it when it was against your skull. But we don't have that, so we're going to skip over that one as well. Your mouth, can I have you open your mouth for me? Say ah. Okay. His mouth is pink, moist. Do you have any cavities that you're aware of?
No, ma'am.
Okay, I don't see any caps. Your gums appear to be healthy. No missing teeth. He flosses. No ulcers. Can you stick your tongue out for me? Then we're going to check his gag reflex. For cranial 12, that's in place. Wonderful. Alrighty. I'm gonna feel your neck now, so just relax. Okay. No edema in the lymph nodes. His trachea is midline and movable. His carotid arteries are equal in rhythm and rate, and it is a steady, equal rhythm. This time I'm also going to check his tympanic pulse, temporal, and his radial. I'm going to skip the femoral. We're going to do his popliteal, his post-tibial, and his pedal pulses. And they are all palpable +2. Okay, this time I'm going to stand up and I'm going to come and listen to you from your back. If you'll just sit forward on the couch for me. Alright, first thing I'm going to do is ask you to take a deep breath. Okay. And take one more for me. Okay. And now I see that his lungs are expanding equally. I'm going to go ahead and listen to your lungs. Just continue to take some deep breaths. Alright, if you can just repeat after me, I'm going to check for primitives now. If you could repeat 99,
99,
99,
99,
99.
99.
And check for CVA tenderness over your kidneys now. Is that tender at all?
No.
Okay, wonderful. Alright, I'm going to come around and listen to the front part of your chest now. Couple deep breaths for me, please. Do you smoke?
No.
Have you ever smoked?
No.
Wonderful. I'm going to go ahead and listen to your heart sounds also. Starting with the aortic, pulmonic, Erb's point, tricuspid valve, and mitral valve. His heartbeat has a steady rhythm. Alright, I'm going to have you lie on your back for me now, please. I'm going to check your abdomen. Starting with inspection, I'm going to have you lift up your shirt for me. Not really. Okay, I don't see any type of protrusions. His abdomen appears to be symmetric. When was the last time you had a bowel movement?
This morning.
Okay. How often do you have bowel movements?
Every day.
Every day. Can you describe it to me?
Dark and firm.
Okay, that's good. All right, I'm going to go ahead and listen to you. Sorry, I don't mean to tickle you. Okay, you have some very active bowel sounds. Just after lunch. Okay. So I'm going to press on you now. You let me know if you have any type of tenderness or discomfort, okay?
Mm-hmm.
Okay. A little little bit harder now. Alrighty, I don't feel any masses, everything feels nice and soft, things are moving along down here, okay? So now I'm gonna percuss on you so you just relax. Okay, liver appears to be appropriate size, spleen is not palpable. Okay, you can go ahead and have a sit back up for me now. I'm going to check your strength and your range of motion now. So if you could push up against me, your shoulders, wonderful, and back down. One more time. Okay. Can you push with your head against my hand? And this way. Push forward. And back. Okay. Can I see you turn your head from side to side? All right. Can you squeeze my fingers for me? As hard as you can. Okay. Pull. Push. Okay. Push up with your hands and pull back down. Now I do this. Wonderful. And then I ask you to push up against my hands with your feet and push down. With your knees, pull up and push down. Okay, he's displaying equal strength on both left and right sides from top to bottom. I'm going to have you stand up for me. If you could raise your knee and lower it. Raise your knee and lower it. Walk towards me. And then back to your chair. Okay, wonderful. If I can have you just repeat my motion like so. Wonderful. Neurologically, he's keeping up with rapid motion. Okay, can I have you stand up for me? I'm going to ask you to take your right heel and run it down from your left kneecap to your foot. Wonderful. Can you do that with the other leg for me? Okay. We're going to check your Romberg test now. If you could close your eyes and raise your arms out to your side, stand still. Let me know if you feel dizzy. I'll help you sit down. Okay, wonderful. You can relax. Alrighty. Another one, I'm going to have you sit down for me. I'm going to check your Babetsky sign. We're going to tickle the bottom of your foot from heel to toe and watch if your toes either fan or curl down, okay? Okay. Whoop. Okay. Curling down is good. Very good. Okay. Can I have you tell me where you are right now? What city, state?
Past Christian, Mississippi.
Okay. Do you know today's date?
11/16/2015.
Okay. He's answering appropriately. I'm going to ask you to remember these three words, okay? House, boat, pencil. Okay. Do you have any family history on either your mother's or your father's side of serious heart, lung, cancer illness? No, not at all? Okay. Not on any grandparents who passed away? Both parents are still living? Okay, wonderful. Are you sexually active? Alrighty. Do you have multiple partners? Are you using condoms?
Yes.
Okay, wonderful. Can you repeat those three words for me that we discussed just a moment ago?
Pencil, boat, house.
That is correct. Okay. Do you have any questions for me? Okay. One last time, so now I'm going to check your reflexes real quick. You let me know if you have any pain or anything like that, okay? So I'm going to check his bicep reflex, my reflex hammer I have here. Wonderful. And check both sides. Okay. If we had a table that his legs could dangle a little bit easier, this would be better. But I'm going to do his patellar. Okay. All right. Well, thank you so much, Blake. Again, do you have any questions?
No, ma'am.
If you have any, you can always give us a call. I appreciate your time, okay? All righty. Thank you very much.